In this lesson, we will study Chapter 15 Diseases of Pregnancy, Childbirth, and the Puerperium, covering code range O00 through O9A. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. By the end of this lesson, students will be able to apply general obstetric coding principles, recognize the sequencing priority of Chapter 15 codes, assign correct trimester and weeks of gestation, select the correct obstetric principal diagnosis, differentiate pre-existing conditions from pregnancy-related conditions, and correctly code major obstetric complications, including diabetes, hypertension, HIV, sepsis, abortion, and postpartum conditions. Importance of Chapter 15. Chapter 15 is one of the most strictly regulated chapters in ICD-10-CM. Obstetric codes override codes from all other chapters, and incorrect sequencing or trimester assignment frequently leads to exam failure. Accurate application of Chapter 15 rules is essential for CPC and CCS success. Chapter 15 Sequencing Priority. All obstetric cases must be coded using Chapter 15 codes, ranging from O00 through O9A. These codes always take sequencing priority over codes from other ICD-10-CM chapters. Codes from other chapters may be assigned only to further specify conditions when appropriate. Incidental pregnancy. When the provider clearly documents that pregnancy is incidental to the encounter and is not affecting the care provided, assign code Z33.1, pregnant state, incidental. In these cases, Chapter 15 codes must not be assigned. Provider documentation is required to support incidental pregnancy coding. Maternal record only rule. Chapter 15 codes are assigned only on the maternal medical record. They must never be used on the newborn or infant record. Conditions affecting the newborn are coded separately using Chapter 16. Trimester requirement. Most Chapter 15 codes include a final character that identifies the trimester of pregnancy. Trimester assignment is based on provider documentation or the documented number of weeks of gestation. Accurate trimester selection is mandatory for correct code assignment. Delivery during admission. When delivery occurs during the current admission, an obstetric code with an in childbirth option must be assigned if available. If an in childbirth option is not provided, the code for the current trimester should be assigned. Admissions spanning trimesters. If a patient is admitted in one trimester and remains hospitalized into a subsequent trimester, assign the trimester corresponding to when the complication developed, not the trimester at discharge. For pre-existing conditions, assign the trimester at the time of admission. Unspecified trimester. Codes for unspecified trimester should be used rarely. They are appropriate only when documentation is insufficient and clarification cannot be obtained from the provider. Fetus identification. Certain obstetric categories require a seventh character to identify the affected fetus. Assign seventh character 0 when there is a single gestation, when documentation is insufficient, or when it is not possible to clinically determine which fetus is affected. Completed weeks of gestation. Completed weeks of gestation refer to full weeks only. For example, if the provider documents 39 weeks and 6 days, the correct code is for 39 completed weeks, not 40. Routine prenatal visits. For routine outpatient prenatal visits without complications, assign a code from category Z34, encounter for supervision of normal pregnancy, as the first listed diagnosis. Chapter 15 codes must not be used with Z34. High-risk pregnancy. Codes from category O09, supervision of high-risk pregnancy, are used only during the prenatal period. They are assigned as first listed diagnoses for routine prenatal visits. If delivery occurs, assign the appropriate Chapter 15 complication code or O80 if the delivery is uncomplicated. Episodes without delivery. When no delivery occurs during the encounter, the principal diagnosis is the complication of pregnancy that necessitated the encounter. If multiple complications are treated, any of them may be sequenced first. Episodes with delivery. When delivery occurs during the admission, the principal diagnosis is the condition that prompted the admission. Any complications of delivery are assigned as additional diagnoses. In cesarean deliveries, code the condition that necessitated the cesarean procedure. Outcome of delivery. A code from category Z37, outcome of delivery, must be included on every maternal record when delivery occurs. Z37 codes are not used on newborn records or subsequent encounters. Pre-existing versus pregnancy-related conditions. It is essential to determine whether a condition existed prior to pregnancy or developed as a result of pregnancy. Correct identification ensures accurate code selection and sequencing. Pre-existing hypertension. Category O10 is used for pre-existing hypertension complicating pregnancy, childbirth, and the puerperium. When hypertensive heart disease or hypertensive chronic kidney disease is present, assign additional codes to specify the type of heart failure or stage of chronic kidney disease. Fetal conditions affecting the mother. Codes from categories O35 and O36 are assigned only when a fetal condition directly affects the management of the mother. The mere presence of a fetal abnormality does not justify code assignment. In utero surgery. When surgery is performed in utero, assign a code from category O35 identifying the fetal condition. Assign the appropriate procedure code. Do not assign Chapter 16 perinatal codes on the maternal record. HIV in pregnancy. For HIV-related illness complicating pregnancy, assign a code from subcategory O98.7 as the principal diagnosis, followed by the HIV-related condition. For asymptomatic HIV infection, assign O98.7 with Z21. Diabetes in pregnancy. Diabetes mellitus complicating pregnancy is coded first using category O24, followed by the appropriate diabetes code from Chapter 4. Gestational diabetes is coded exclusively using subcategory O24.4, without assigning long-term medication use codes. Sepsis and puerperal sepsis. Sepsis complicating pregnancy requires a Chapter 15 code first, followed by the specific infection. Puerperal sepsis is coded using O85 with an additional code to identify the causative organism. Do not assign A40 or A41 for puerperal sepsis. Substance use in pregnancy. Alcohol, tobacco, and drug use complicating pregnancy require codes from categories O99.31, O99.33, or O99.32 respectively, along with secondary codes identifying the substance-related disorder. Normal delivery. Code O80 is assigned only for a full-term, single, uncomplicated delivery. It is always the principal diagnosis, and the only appropriate outcome of delivery code is Z37.0. Postpartum and peripartum periods. The postpartum period extends for 6 weeks following delivery. The peripartum period includes the last month of pregnancy through 5 months postpartum. Pregnancy-related conditions may be coded beyond 6 weeks if documented by the provider. Sequelae of obstetric complications. Code O94 is used to identify sequelae of complications of pregnancy, childbirth, and the puerperium. It is sequenced after the code describing the sequela condition. Abortion and termination rules. Specific guidelines apply to spontaneous abortions, elective terminations, retained products of conception, and post-abortion complications. Correct category selection is essential for exam accuracy. Abuse and COVID-19 in pregnancy. For abuse complicating pregnancy, assign the appropriate O9A code first. When COVID-19 is the reason for admission, assign O98.5 as the principal diagnosis followed by U07.1. Chapter 15 codes always take sequencing priority. Common CPC exam errors. Common errors include incorrect trimester assignment, using non-obstetric codes as principal diagnoses, coding O80 with complications, missing the outcome of delivery code, and assigning fetal codes on the maternal record. Exam recall summary. Remember that Chapter 15 always has sequencing priority. Trimester accuracy is essential. O80 applies only to truly uncomplicated deliveries. Z37 is required when delivery occurs. Chapter 15 codes are used only on the maternal record. Lesson Summary. This lesson reviewed obstetric sequencing rules, trimester requirements, principal diagnosis selection, major pregnancy complications, postpartum conditions, abortion guidelines, and sequelae coding. Mastery of these concepts is critical for CPC and CCS examinations.